next, we'd like to introduce to you Hotline. And I met Hotline quite a long time ago, and I never thought we're going to meet again here. And I always thought, Hotline, you're from Kalimantan. Hotline lives on the edge of a forest in the middle of nowhere, is where I'd say. But Hotline, you're not from Kalimantan. Tell us more about where you're from.
So I'm from Sumatra. Indonesia has 5 big islands. I'm from the other biggest island of Sumatra. And then I raised and born in Sumatra. I went to dental school in North Sumatra. And then I finished dental school. I went work in a government clinic for 4 years. And I've been having calling to do community development. So I always want to do something for community, especially underserved community. When I was little, I grew up from, my parents were teachers. So I read books about people doing inventions in their lives. So I've been wanting to some of those people who make a difference in people's life. And no matter how big or small I can do, so I've been wanting to start something new and to make something in the community. So I worked for years in the community development, rural area in the clinic. And then 2 years I went to South Sumatra. There I ran a mobile boat clinic in the river boat of Musi River. And I see patients in my boat. So rocking, but I managed to drill my patient in a boat. and I enjoy that work. And then
what brought you to Kalimantan, which is on the other side of Indonesia, and I told you near a jungle. What brought you there, Hotline?
The universe. Friends, reading, and mutual friend, telephone.
So, Hotline, can I say what's happening in your park? So, Hotline runs a clinic which serves a community that lives right next to one of the most endangered parks in Indonesia in terms of biodiversity. Again, Indonesia is the second biodiverse country in the world after Brazil. It's a mega nation, full of resources and natural wealth, which present both a curse and an opportunity for Indonesia. So Hotline works in one of the endangered areas for orangutans. And what do orangutans have to do with your clinic?
We have one orangutan stay in our clinic, but that's not the whole story. So our program based on philosophy that as human being, we cannot live healthy without healthy environment. So we address this issue by working day to day with community, and people live there are very poor. They often choose to do logging to earn a living. And one of the earn of living they do to pay for medical emergency. So we provided health care to cut the need for them to log the forest to save their lives. So we provide more long-term solution to their short-term needs.
So you see, it's a really wonderful model of conservation, community development, and healthcare, that a person should not have to choose between saving a forest or saving their child's life. So your idea is that if you help them in their day-to-day economic needs and health, they won't need to do the logging. Hotline, say something quickly about how, I think it's quite a sophisticated clinic you have, but still you have projects that you want to grow. How do people pay for that? How do you fund your place?
Before we started the program, we asked the community, we have the beautiful forest, which is not only benefit for the local community, but for Indonesia or for the world. If the world were to say thank you for protecting the park, what would you ask the world? And the community said they want healthcare. And they also ask for farming, training farming, because they say if they have healthy, they also want to have they just don't want to have a healthy body, but they also want to have a healthy pocket. So we work with community integrating these ideas in our project. So we give discount for community who protect the park. So if they pay, if they come from a green area, which we call it, no distractions in the forest, they can only pay our doctors cheaper than a bowl of bakso, a bowl of meatball soup. So everyone can afford. But even they cannot afford, they still can pay with non-cash payment, which is they can pay with seedlings. And then the seedlings also we can plant in the deforested area. And they also can pay with manure. They also can pay with handicraft. So we provide access for them to healthcare that is not free, but empower them to afford that with what they can.
Hotline, last thing, you have a lot of challenges in running that place. Are there any personal challenges that you would like to address in the near future, work-wise or otherwise? You don't have to answer that straight.
Yesterday, I remember the session, what the leaders should have. I mean, so leaders should have vision, risk, able to adapt, and elevate others. So my next goal is how I can maximize myself to elevate others.
You want to be a leader. Great.